Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Breast carcinoma, we are looking at the risk factors as well as the protective factors. So first we are looking at the risk factors. So in terms of the age, it is the incidence increases with increase in age. So it increases with age increasing. Next is, what about the sex? It is very common in terms of the female. So what about if is family history relevant? It is very relevant. So it is common with family history. Then comes the question on the race. So race and ethnicity. So what about race and ethnicity? So under race and ethnicity, the white women have increased risk compared to the women of other races. So it increases in terms of the white women. So it increases in terms of the white women. And there is history of radiation exposure. There is history of radiation exposure as well. And the mammographically, there is presence of the dense breast. So mammographically, there is presence of dense breast. Now, let's look into the genetic factors or the mutations. So under the genetic factors of mutation, there is the BRCA, there is BRCA1, there is BRCA2, as well as there is presence of TP53 and the CHEK2. Then there is also presence of the hereditary syndromes. Hereditary syndromes such as the Li-Fraumeni syndrome. So there is Li-Fraumeni syndrome, as well as the presence of the Cowden syndrome. There is Cowden syndrome. So Li-Fraumeni syndrome, Cowden syndrome, then the HNPCC syndrome, then the Hughes-Jaeger syndrome, we are writing it as PJ syndrome, and the ataxia-telangiectasia, we are writing it as AT. Next is the hormonal factors also plays a role. So it's hormonal factors. So here the hyperestrogenemia is a risk factor. So there's hyperestrogen. So hyperestrogenemia, this is a risk factor. So what are the factors involved? The factors involved, there is a presence of the early menarche. Next, there is also a presence of the late menopause. There is presence of late menopause. Next is the first full-term pregnancy. So this is the first full-term pregnancy. So this first full-term pregnancy is nothing but it is greater than that of 30 years. Next is the nulliparity, and also in terms of the obesity. So they all form in obesity, that is the postmenopausal. So all these forms the risk factors. Lastly, the socioeconomical status also plays a role. So in terms of the higher SES, that's the socioeconomical status, accompanied by the high fat diet. So with the high fat diet as well as the alcohol intake. So there's also presence of the alcohol intake. Next, we look at the protective factors. So what are the protective factors in terms of the breast carcinoma? The protective factors, it includes the early age of first pregnancy. So in terms of early age of the pregnancy, this is a protective factor. Next is it involves a multiparity. Then there is also involvement of the breastfeeding. There is involvement of the breastfeeding. Then there is the oophorectomy, and the presence of the exercise. There is involvement of exercise, as well as there is the tamoxifen. So there is tamoxifen and Also, the presence of the aromatase inhibitors. So this tamoxifen as well as the presence of aromatase inhibitors. To learn and grow daily like this, please do subscribe.